Good afternoon, Marina. Thank you so much for joining us for this special episode of Thrive with Us. I'm really excited to have this conversation with you. We're going to talk about all things fathers. So, we're going to talk about how important fathers are in general and also how effective and critical they can be in a therapeutic process. Before we begin, I just want to take a chance to introduce you to our audience. So, I'm sitting with Dr. Marina Hakimian with a PhD from Adler University in the United States. You have been with us at Thrive Wellbeing Center since September 2021, and I know you see children, adolescents, and adults, but most of your caseload is with children, especially the younger ones, and I think we're going to draw from some of those experiences in our conversation today. Thanks, Marina, and welcome.
Thank you very much, Sarah, for this introduction. In fact, this topic has always been at the back of my mind all the time throughout my career. And the reason is that every single time I had clients in the clinic environment, all the time it was mothers bringing their kids. So I always wondered that in the beginning it was very normal because it became normalized. It looked like, oh, the person who does the nurturing is the mother. So there you go. Anything related to education, anything related to mental health or any other kind of health, even to rushing to the doctors. It's usually the mother who rushes the kids to the doctors. So when it started becoming more repetitive, I started realizing that as a clinician, I need some feedback from the father.
Of course.
Because they do have very valuable information that it's impossible for only the mother to be able to capture that within the household. So I was glad that the topic is about this because I really have a lot of feedback, a lot of personal experience, a lot of experience with my clients, and also the way I see how we're moving throughout, our lives, making sure that we're really, really being able to be supportive of the children by taking a very good way of, I wouldn't call it advantage, but parents are the most valuable resources for our kids.
So it's inclusive to have the father involved.
Of course. So I'm happy to dive in with any questions.
Yeah. So, I mean, for me, I remember when I first started researching parenting as part of my master's and my PhD, I thought it was almost funny that all of the parenting research was, and to a degree still kind of is, based on mother-child relationships for the reasons that you just mentioned. And the idea was that, well, dads are kind of useless. They don't have time because they're so busy providing, and anything that really has to do with the kid, the mom is going to know. So let's just bypass dad, who doesn't have time for us anyway, and go straight to mom. And obviously that couldn't be further from the truth, especially now in this context where we see on a general and global level that fathers are becoming more and more and more involved. And we see from the research that the involvement of fathers is critical for all of the development, the behavioral, the psychological, the social, the emotional, the academic. So engaging them is really, really key.
Definitely. Now, there's a term that we can refer to. It's the role of masculinity, basically. So a lot of times we realize that, okay, the breadwinner is the father or the husband. His job is to go, work, make money. But nowadays we do see that there's a huge change in role assignment. And you see that mothers are working too, fathers are working too. So there's a lot of, we can even talk about the nanny's involvement in general, even with the parenting scenario itself. But with all these changes happening, still I see that the father's role is even neglected, not intentionally, but historically it was neglected. It created this norm, and it became very normal for him or for the father not to attend such meetings or such, or be part of such conversations. And it continued. But then when we read about child psychology, when we read about the importance of the dynamics at home, the
Yes.
importance of mom and dad, what they both do in the household, what they do outside the house, this all impacts the overall well-being of children, even their intellectual capacities, their problem-solving skills, their resilience, their sense of identity. All of these factors are impacted by the involvement of both mom and dad. Now, I'm not saying this topic specifically is not only about the involvement of fathers in parenting. It's specifically about involving fathers within the therapy
Yes.
journey. For example, if within the therapy session the clinician gives advice to the parents or to the mother, let's say in that situation, if only the mother is present, fair enough, the mother is going to take over whatever is said, and she's going to start applying some of the things there. If the father is unaware of the methods being discussed or the strategies being discussed, it's going to create some disconnect between the actual goal we're working towards and what's actually going to happen.
It's inconsistent.
Exactly, it's inconsistent. So involving the father, this is something very interesting. There was this article I was reading, and it mentioned that it's mostly part of the clinician's orientation to be equipped to be reminded that involving both parents is important. Not all clinicians look at this very specific topic as a must within the therapy session. So many orientations, they just say, just focus on the child, work with the child, and that's it. Other orientations, more family orientation, or more family systems therapy orientation, goes more into the detail, the dynamics between the family, mom, dad, involvement of every single individual, including siblings,
Yes.
in the whole dynamic. So this interesting article, they were talking about, they did a research about clinicians, and they asked them a question like, how often do you see fathers versus mothers when you ask someone to come in for a consultation to discuss your child's concerns about your child? And most of them, obviously, they said we mainly see mothers. And one of the therapists who was part of the research, she mentioned that, wait a minute, even if I have the mother and the father both present within the clinic, she has the tendency to look at the mother when addressing anything, or even asking questions. What would you like what would you like therapy to focus on? What are your goals? What are your expectations from this therapy? So this eye contact, it really caught my attention, because it's true. I reflected on myself, and a lot of times, although I try my best to include both parents, maybe I do have the tendency to look at mothers.
It's an implicit bias, I think, for most people, and that implicit bias is formed from a number of places, including all of the messages and the gender roles and all of these things that we were exposed to over the years. But one of the things that I wanted to comment on is, you mentioned that mothers are often the go-to. And I mean, we see that anecdotally, even when the school is going to call because there's an issue or something going on, usually they'll call the mother's number first. Exactly. and then the father's number, no matter what order you listed in, and so on and so forth. But let's say that, a mother was exclusively responsible for taking her children to a healthcare checkup. Healthcare is a little bit more objective in that, okay, I'm reporting to you the symptoms, and that's information that I gathered relatively objectively, and that probably is visible and everybody knows. But when it comes to mental health, there are so many lenses and layers. The mother, of course, can speak to her dynamic with the child's dynamic with others, but the father has a different lens and a different relationship and a different perspective that is very, very, very enriching. And so engaging them from the get-go allows us to capture that. And I think as well, like in line with what you were saying, it's also empowering for the fathers that you actually matter, like you do. You're not just a paycheck. You are an important person in raising and shaping your child. And we need you and your opinion and your involvement so we can figure out what's happening. And so that when we decide on the strategies you were saying in terms of moving forward and giving interventions, if mom is perfect and dad's not doing it, or dad doesn't understand it very well from her because there's a communication gap or something, then also that's confusing and not going to have very good therapeutic outcomes. So
I fully agree with everything you just discussed. What I've also noticed is that a lot of times, when the mother relays the messages, when the mother comes in, for example, to the consultation and says this and this and this and this is happening, usually it's the emotional part that they discuss. It's everything, which definitely it's our field. It's the part that we need to address. It's the most important aspect of child development and human development in general. But so many times we miss also some of those objective observations within the household. A lot of times I see fathers, they describe the same situation in a very different way, and it gives you a different perspective. And you're like, wait a minute, okay, let's bring these together and then understand the impact of this on the same child.
yes.
So, and I think we all know fathers, if we were to give them some strategies, they really need a very structured 1, 2, 3 kind of recommendations. But the mother, within the consultation or within the therapy journey itself, you see them, they have the need to talk, the need to be heard, the need to express. Because a lot of the times we see that the issues that the parents are going through are really about their own personal issues dealing with the parenthood. So they get triggered from different things in the child's behavior, child's academic achievement level. They get like impacted in various ways.
There's a lot of different layers and inputs and things that are coming up as part of the therapy, where the child might present with a certain issue, and then through your work with them, you're uncovering that there's a lot more pieces to the puzzle.
Yes, and also we definitely need to give enough time for families to be able to openly share the things that they're struggling with, the things that they're proud of in their, because a lot of times parents do express to us that they're doing a lot of things that are really working well, hence why they continue doing these things. But they come to us when they're struggling.
Yes.
And most of the time, and I think this is very important to mention, if there's parental conflict in general, not necessarily regarding the parent, not necessarily in the parenting, if both parents have a conflict for whatever reason, it could be couples related situation, you will always see that this is going to impact the child's development anyway. So within the consultation, we always see my role changing into all of a sudden a couples therapist starting to kind of calming their emotions, like, wait a minute, let's just hear from this side, let's hear here. So there's always a disconnect between exactly what happened and exactly how things are perceived by each and every parent.
Of course.
So our job there becomes a bit more difficult, because apart from talking about the child, we start addressing the dynamic and how these parents are communicating, let alone what the kids are seeing at home, let alone how this is impacting their overall, confidence, safety, and kind of feeling connected with their own family. So I think this was again, this field is very, very complicated and complex, I may say. The more we see clients, the more we learn. And the more we learn, the more from our own personal experiences, we also find that here it is. We are all struggling when it comes to parenthood.
It's difficult. There's no manual for it. And even if you think you've got it down pat, not every child is the same, and situations and contexts change, and we get curveballs like the COVID-19 pandemic and various other things that upend that. So definitely it's always a work in progress. But I want to take this opportunity based on what you just shared, which has to do with the parental relationship, to maybe share a couple of caveats or disclaimers with our audience. The first is we've been using the word father. And I think really what we're talking about is a father figure. So this can be a biological father, it could be a stepfather, it could be an uncle or other male significant person who is
Right.
stepping in as the male
Caretaker.
caretaker. And the same thing with mother. And the other thing that I think is important to mention is that when we say fathers are critical, there are some situations in which there is no father and there is no father figure. And we are not in any way, shape, or form saying that this child is not going to be healthy and that this child cannot have a successful therapeutic outcome. What we know also from research, and correct me if I'm wrong, is that it's better for a child to be in an environment with one caregiver, caretaker, where it's calm and stable, rather than with two, where it's a hostile and volatile situation. So hopefully anyone watching, listening, regardless of their family system, is understanding that our point here is that a male caretaker that we are labeling as a father can be really important for development and therapy. However, you can still be healthy and adjusted and succeed in your therapeutic journey without.
Definitely. There's one I was thinking about it when you were discussing. There's this assumption that men in general, and whether it's in the movies or what has been discussed historically, there's this accusation that men, are the neglectful ones or the coercive ones or the more authoritarian ones and the more
distant ones.
Exactly. And even in certain situations, the abusive one, in very unfortunate situations, of course. We don't want to go there, but I think the reason why I'm here today is also to change a little bit of the perspective of our audience that that's not necessarily true. I mean, both mom and dad have very unique contributions in this journey. And let alone a human being by himself with his own life history, with his own way of being parented, with his thoughts, ideas, beliefs. So I'm sure there's the need of this person to be valued, to be appreciated, and to be taken seriously a lot of times. And because I see this in the clinic, a lot of times mothers interrupt the father when they're coming up with something. If they're discussing something, I do have this immediately the mother jumping, say, no, you don't understand it. You haven't been there. You haven't seen when this is happening. It's not, oh, you're at work. There's this
and both of those things can be true.
Of course.
Right? He might not have, or she might not have seen something, and it can still
It can
be
happen.
something that's happening.
Exactly.
Yeah.
So back to the topic itself, which is involving both parents in the therapy session, and specifically fathers. I personally have found a lot of value. It actually made my job even more easier to support the child because I have feedback from both sides. And oftentimes I do want to kind of come up with a plan in the therapy in such a way that we are kind of supporting the whole dynamics of the family. Like it's not just that we need to improve the symptoms that the child is exhibiting. It's also creating a household where everybody's safe, loved, nurtured. And I need all partners to be there.
Of course.
It's very difficult for me or for any clinician to be able to kind of maximize those strategies to be able to have those optimum outcomes.
So they're important to be there for the reasons that we've already discussed today, and yet they're not coming as much as we would like. We talked about this a little bit already, but what do you see as the primary barriers to engaging fathers in therapy?
First and foremost, the role expectation itself. Since historically it's been known that the father is at work and busy. So for work commitments, obviously, there's this justification, and very valid justification, that he couldn't take some time off, or his work environment didn't normalize that this father needs to be involved in his child's life. because in this masculine society, people think that, and even management thinks that, okay, the mother can do it. Well, the mother is working too. So who's gonna come to this school meeting? Let's say who's gonna come to this therapy meeting? Of course, there's a lot of factors that play, but most of all, of course, we know it's work commitments. Also, this expectation that usually the father's own expectation that, oh, this is not my territory. My mom can deal with it. And I trust her to deal with it. There's this as well. So if women don't empower their husbands to be part of it, the male is fulfilled already because he has instilled his own trust in the mother because he trusts that she's going to take good care of the situation. Now, so in terms of barriers, we mentioned work, that cultural norm that fathers are busy at work, mom can definitely handle.
And it's more acceptable for her to take time or to leave early or to do whatever.
Exactly.
And it's interesting, this point, because I remember listening to a podcast and reading up a lot on the gender pay gap that we see exists on a global scale. And one of the primary explanatory factors for it is that women end up requiring more flexibility as they become parents, and that ends up stalling or stagnating their career trajectory because that ascension usually is in line with when we're having a family. Males, on the other hand, that have young children that would require this kind of support, they're at this point where even if they see and even if their wife believes that they would be valuable and even if they have the skills and self-confidence to recognize their importance, they don't want management to look at them as the guy who's picking family over the career.
Exactly.
And so ends up staying home, further reinforcing all of these things. And then what ends up happening, we miss out on that critical piece of information that could be beneficial to the child. So, it's difficult to change society and gender roles and expectations, but a wish I think that we probably share is that workplaces were a little more inclusive and understanding and recognizing that the role of the father is a critical one, and we shouldn't have to choose between being a dad or a mom and being a professional.
That's really it is the case. It is the case. Thankfully, these days there's a lot of companies and organizations that are seeing these, as important. At the end of the day, we want to make sure that whatever we're also doing for our communities to help them, to give them advice, to support them to, in their parenting journey, we are lucky if we're able to live by that as well. So I'm happy to say that Thrive is a place that encourages mothers to always be present in school meetings and all that because of the flexible timing, which brings me to recommending or to suggesting something that can actually help the clinicians to involve more the fathers. When it comes to flexibility, I think we're realizing that a lot of times now clinics are opening for even for a longer period of time during the day to accommodate for those who need to be present in such meetings. So I think that flexibility itself is allowing, for work. If a parent is not able to attend due to work, then they can book always the session, which is a bit later after work hours.
Yeah.
So I think that's one way. Another way is, I think we need to be straightforward. Sometimes you need to pick up the phone and actually call the father and, in a very beautiful way, introducing yourself, telling them who you are, what you do, how long you've been here, what's the reason of the call, what's the reason of involving him in this journey, can be a very good introduction and empowerment for the father to feel that, okay, I matter, my ideas are valuable, and someone is giving me that opportunity to make it happen. Well, of course, there's always going to be that person who doesn't want to be involved in such matters, because a lot of times there are certain individuals who truthfully feel that they don't want to be involved in such matters. They trust the other partner. That's okay. But again, we want to give the chance to every partner or both partners to be able to voice their concerns, their hopes from the therapy. And how many times have I found in my sessions that instead of supporting the child through having that consultation and all the information coming from both parents, we end up redirecting the mother or the father to
For
therapy
individual
for their
therapy.
individual support.
Yeah.
And imagine the impact of that on their parenting skills later on once they...
Absolutely. Absolutely. And so I appreciate that you were highlighting things that can be changed. We discussed on a societal organizational level, but then also for the clinician, you mentioned having kind of more extended hours, which is great. And I know that's something you do. You have some evening slots and you have some weekends, and I know those are the ones that are most in demand. At the same time, it's a little bit tricky because then that ends up infringing on the family time of the clinician. But anyway, I think ultimately it would be helpful for our audience to understand that typically in a therapy process, parents are met at the beginning to gather that history, background, and information regarding the presenting problem and the goals for therapy. And then, depending on the case, from time to time, parents are brought in either to be given feedback on the progress of their child, or there's like an incorporation of parental guidance sessions. So it's not an expectation that parents are going to be there or that dad is going to be sitting in the waiting room with mom session after session, day by day, but rather that at those critical moments of the process, that initial input and receiving the feedback, that they are somehow involved. And the time commitment isn't too much. It doesn't have to be. And there can be more flexibility as well. I imagine that with some that fathers and also busy mothers with whom you have an existing relationship, that some of the feedback can be by an email or on a virtual call that they can take on a 10-15 minute break as needed, right?
Yes, of course. And I've noticed that the families that when both mom and dad are involved, I definitely see the outcomes are much, much more solid and achieved.
Yeah, absolutely. So
I see that, and that's why I want to keep on encouraging fathers to be involved within their capacity. And as you said, even if they're not able to come in, the drive time and then coming in person, there's always other ways to keep them informed. Sometimes just keeping them informed by itself can also be very helpful, because then they can take the message and kind of apply some of the things that we recommend them, so
And-
that the child can benefit from those.
And I think ultimately as well, it helps to change that narrative. You said that one of the biggest things is the role expectations, gender role theory, the role of masculinity. We talked about that on a societal level, at an organizational level, but encouraging and involving them also helps reshape and shift that discourse, right? That you do matter, you are important, you do have valid contributions, and you are a critical caregiver and shaper of your child, whether they're in therapy or not, and certainly important for somebody who is in therapy and has something that they need to work on. So I really hope that everybody listening to this is going to take a minute and reflect further on the relevance and significance of fathers alongside mothers, using the definition that we mentioned previously, and that fathers are going to become more actively engaged in the therapeutic process for the benefit of their own well-being, their relationship, and their children's outcomes.
And research does show that the involvement of both parents can have enormous health benefits to them.
Yes.
In terms of when you're involved and when you're supporting someone, and specifically for emotional needs, there's this immense satisfaction that you've done something. There's also these parents feel more confident. They feel that their parenting journey is successful, and they're proud of their family. They're proud of their work, that they have been part of this collaborative approach between them, the clinic, and whoever has been involved in the treatment plan in general.
So fathers, their involvement is important for their own outcomes, the relationship outcomes, the marital outcomes, the family outcomes, and for the child outcomes. So again, hopefully this will encourage people to participate and reinforce those fathers who are already actively engaged in the therapy process. Marina, thank you so much for your insights and for your time today. I mentioned at the beginning of this episode that you are with us at Thrive and have been since 2021, and people can reach out for support, whether it's for their children, their adolescents, or themselves, and you offer your services in English, Arabic, and Armenian.
Correct.
Thank you again
very
for
much,
your
Sarah.
time.
And happy Father's Day, by the way. It's June 21 is Happy Father's
Oh,
Day,
yes,
right?
that's right. It's coming up. And Men's Mental Health Month. So
Exactly.
we're shooting this at a very relevant time. So happy
Perfect.
Father's Day and Men's Mental Health Month to everybody out there.
Thank you so much.
Thank you.